Welcome everybody. Thank you for joining us for our August webinar. We are focusing today on understanding additional needs, obviously with the backdrop of COVID pandemic and lockdowns. We've got a really amazing array of speakers for you today, and we'll come on to that in a minute. If you could, in time-honoured tradition, mute yourself, make sure you stay muted. That cuts down background noise. If you're able to change your display name, as Kate requested, to your name and your organisation name, it helps us keep track on who's attending. The webinar is being recorded and will be shared through our social media on our YouTube channel after the event, so please do keep that in mind, and please do alert people who might want to catch up who couldn't make it along today. And there is of course a chat box, and we like to keep the chat box open, so please do make comments or ask questions available to everybody, and we will pick up interesting points for discussion towards the end of the webinar. I'd like to kick off with a quick intro, a few intro slides before handing over to our keynote speaker. We are obviously on the first full day of events at the Paralympics in Tokyo, and we had the opening ceremony yesterday, and already Dame Sarah Storey has won Britain's first gold medal, which is fantastic. And as a cyclist, seeing someone who's transitioned from swimming to cycling and seems to be even better at cycling than she was at swimming, it's wonderful to see. And the quote we have from Stephen Hawking dates from 2012, but is very, very timely and relevant today. And I think like many people, I will be watching some of the Paralympics in the coming days, and marveling at the wonderful human spirit that we see in those events, just as we saw at the Olympics recently. To come slightly more close to home and give you a few numbers, in Oxfordshire we have upwards of 26,000 people who are in receipt of disability benefits. That is probably a pretty small percentage of the overall number of people who are living with a disability. The estimates range from 15 to over 20% of the population experiencing disability, and I think it's not an easy thing to define. It's not a black or white. There are a lot of shades of grey in there. But I think we are talking about significant numbers of the population whose lives are impacted to some degree by disability of one sort or another. And the next slide shows, which will probably not surprise you, that levels of disability are concentrated in areas of deprivation, disadvantage and exclusion across the county. And this is of course because disability is both a cause and an impact of poverty. And so you are far more likely to find people living with disability in areas of poverty. And that means that our work in Oxfordshire Community Foundation, which we focus on those who are disadvantaged and excluded, and focus on addressing inequality across the county, means we will be working with very many people and groups who are supporting people who have a disability and living with a disability. And we're going to hear from some of those groups through the session today. Also picking up locally, we have recently published a fantastic Journal of a Pandemic Year report, and I say it's fantastic because I didn't write it and produce it. That was done by the wonderful team of OCF, that spotlights on the over £1 million paid out in the first year of the pandemic response. Almost 300 organisations supported, and to date that sum has now gone up to well over £1.25 million, and we'll be continuing to spend down on the generous donations we've received in the coming year to try and put communities in the best place possible for responding to and recovering from the pandemic. And several of the organisations that have been beneficiaries of that funding are featured here today as just a few of those organisations working around the disability sector that we have been supporting and working with. So to come on to our speakers for today, I'm delighted to say we have Kamran Mallick, who some of you will probably know, who's Chief Executive of Disability Rights UK, one of, if not the leading organisation in the UK campaigning on disability rights and inclusion. Then we have Mark Upton, who is, I think probably a relatively new Mark, but maybe starting to feel a bit longer in the tooth now, CEO at Oxfordshire Association for the Blind, who is the first Chief Executive of Oxfordshire Association for the Blind who has lived experience of living without full sight. Then we have Gita Lobo, who's Chief Executive of Autism Family Support, and I know they have done fantastic work over the last year and before that, supporting families across the county who have a child with autism. And then we have Nigel Taylor, who is a trustee at My Life, My Choice, who are a nationally recognised organisation who work in Oxfordshire and are fantastic at putting people with lived experience at the heart of and front and centre of what they do and how they work. So I'm really looking forward to that conversation. And then, of course, at the end, there will be the normal Q&A. So please do post comments in the chat box as we go. But without further ado, I'd like to hand over to Kamran Mallick and ask you to give us a background introduction to disability in the UK, please.
Thank you very much, Adrian. I'm really pleased to be here. It's actually quite nice to be on a platform where it's not a webinar, so we can actually see everybody who's in the audience. So it's really good to see so many people. Thank you for inviting us. So yeah, my name's Kamran. I'm Chief Exec of Disability Rights UK, and as Adrian said, we're a national organisation. We're a disabled people-led organisation, which means that the Board of Trustees of DRUK are 85% or more disabled people, and at any one point, 60% of our staff team are disabled people. So the lived experience of our lives drives everything that we do. We're really at the core of our organisation and the work that we do. We're about bringing about rights and inclusion for disabled people across the nation. And we do that by having individual disabled people as members and disabled people-led organisations up and down the country who act as our kind of voice of what life is like every day for disabled people. And then our policy team works to campaign and influence government, people in positions of influence and power, to bring about the changes that we want to see. And one of our core aims is around making sure that the route for disabled people to take up positions of influence and power are clear and supported, and because we believe that by getting disabled people in those positions, we end up having better policies and legislation and guidance. So the pandemic, which I guess we're not really out of, we're still in it, we're still living that every day for, it started last year in March, and very quickly what happened is I'm going to give you a flavour of the kind of things that we were hearing on the grounds from disabled people, and just how fast moving it was. I was looking at the kind of points that I should cover, and it got to a point where I could talk to you for about an hour and a half and still not get through everything that was going on for disabled people. Life has been and is very difficult for disabled people, and the pandemic really highlighted the frailty of support networks, support systems, local authorities' ability to provide support and care to disabled people at a time when it was needed. And while the government talked about protecting the most vulnerable, those most in need, the actual data and the stats that we now have access to certainly don't show that that's what happened. So the coronavirus has hit disabled people hard. 60% of deaths that we now know about from the virus were for disabled people. So that's a disproportionate, if you think about the numbers of disabled people in the UK, and when you think about 60% of those who died being disabled people, you can just see that there's clearly an inequality of how both the virus was affecting people, but also then how our support systems were or were not protecting disabled people. So back in March last year, of course, we all went into lockdown, but it's fair to say that lockdown for disabled people was considerably harder within the UK due to one of the key things around inaccessible housing. And that was a key finding of the YouGov report back in July, August last year. So it was relatively near to the point when we went into lockdown. And what it showed was that disabled people were 17 times more likely to be unable to undertake kind of routine activities without assistance during the lockdown. So we were 3 times more likely to have suffered impaired well-being as a result of our housing situation than when you compare that to non-disabled people. About 2/5 of disabled people were unable to fully use their bathrooms and kitchens without assistance during that time. And of course, we then also had at the same time, very early on, something called the Chronovirus Act that was released by government. And that Coronavirus Act kind of gave a signal to local authorities, was that it was okay to reduce care and support to the people who really, really needed it. It gave the signal from government about the The government's excuse was that we're trying to protect people, and therefore when resources are limited and staffing becomes an issue, it's okay to reduce the support from the very people who we are talking about wanting to protect. So at the same time as doing that, the government talked about shielding. 2.2 million disabled people were asked to shield, or those with underlying health conditions. And when I talk about disabled people, I mean not just disabled people, well, we're talking about disabled people that meet the definition of the Equality Act, but actually it's about self-definition. So for a lot of older people who may not think about themselves as disabled people, but actually the impact of a health condition may mean that they are still under the definition of a disabled person. So if you imagine 2.2 million people asked to stay at home, not to step out their front doors, to rely on food package deliveries, to not suddenly have access to all the other support systems that they may have had in the past. So we started hearing from people who said, I've been ordering, I've always ordered food online through whether it be any of the supermarkets that are available, and suddenly that route was no longer available because everybody else was taking up the slots. And you could only get access to priority slots if you happen to be on this priority list. And even then there were problems. And our argument really was at that time was that under the Equality Act, because that was still in operation, still existed, supermarkets have an obligation to make adjustments to make sure that their services are available to disabled people, but they were not doing that. What supermarkets did instead was hide behind government departments to say we're doing what the government are asking us to do, and not accounting for any other additional needs. So we had issues with access to kind of shopping and food for disabled people. At the same time, you're probably all familiar with the term PPE now. I'd never even thought of it before the pandemic hit, and suddenly PPE was in front and center of all our minds. So we heard about PPE not being available to doctors and nurses in hospitals, in care homes. But one of the stories I guess we didn't hear about was disabled people who relied on support workers coming into their homes, PA staff, carers who were coming into your home to provide you with support, your independent living support that you had an entitlement to. Those individuals were just left to defend for themselves, really. And there was no direct initially way for those individuals to access that really important equipment. Access to healthcare was stopped. And of course, that impacted on everybody in the country. But for many disabled people, regular access to healthcare is imperative. And we heard from lots of parents of disabled children who just said that when access to key important healthcare stopped, it had a dramatic negative impact on that individual. And the impact meant that for many future years, you would never get that time back because of the impact that had. I've already mentioned kind of other kind of access to services were reduced. But again, for children and other disabled people who were accessing daycare services, suddenly all of that was stopped. And we heard from families who were just really struggling. And I'm sure you recall stories about that in the media. Do not resuscitate orders became a blanket approach for disabled people. So suddenly we were hearing from disabled people who were telling us that they'd had the DNRs put on their records with no conversation, no dialogue at all. They were not instigated by disabled people. They were instigated by the medical staff, or whether that be the GP system or hospital staff. Assumptions made about whose life is worth saving and who's not. Assumptions made about what your wishes were without a conversation with you. Completely unacceptable. The whole messaging around remaining active, getting out for your daily activities, the whole messaging was around if you could get out and go for a walk, if you could get out and go for a run, all well and good. But there was no other messaging that really targeted disabled people for whom remaining active, remaining healthy, your mental well-being, not part of the messaging that was mentioned. So a really difficult time for disabled people, and it's really hard to find throughout the pandemic anything where I can say, this went really well, because for everything disabled people, our organisations, both Disability Rights UK and many of yourselves who represent different members of the community, different organisations, no doubt had to fight locally and heard from all the stories from the people that you engage with. I just want to mention a bit more about food. So another report that was produced during the time by the Food Foundation in March this year, it showed that the most seriously disabled people experience 5 times the level of food insecurity compared to the wider population. 25% of disabled people who are limited a lot by their impairments experience food insecurity, and 11% of people, disabled people who are limited a little, have food poverty. That compares to 5% of non-disabled people. And I know Adrian said already earlier, he referred to the link between disability and poverty. The Joseph Rowntree Foundation says that 7 million of the 14 million people in poverty are either disabled people or have a disabled person as a member of their family. So these are huge numbers. And just on kind of the pandemic phase, I guess, the benefits, so you may be aware that there was people on universal credit were given a £20 a week uplift as part of the pandemic response. But if you were on a legacy benefit, so that means some of the other benefits that preceded universal credit, that wasn't made available to you, and it still wasn't made available to you despite lobbying from organizations such as ours, but also other organizations such as the Benefit Consortium. And then there was the whole issue around vaccination, access to vaccinations for disabled people, wearing of face masks, and the mixed communication and messaging that was coming out. So it has been an incredibly difficult phase for disabled people. So I'll kind of stop there on the pandemic, but I was asked to talk a little bit about our response to the disability strategy. So the Conservative government, when they came into power last, as part of their manifesto, they talked about a transformative approach to disabled people in our lives, that they would produce the disability strategy that would be far-reaching, transformational, and would be kind of once in a lifetime opportunity. And I guess we all held on to that hope, despite being let down previously. And I'm just going to read a little bit from a blog that we've recently put up that refers to the national strategy. So 4 years after a scathing report from the United Nations on the UK's implementation of the Convention of Rights of Persons with Disabilities, the government published its disability strategy at the end of July this year. The strategy acknowledges the unequal life experience of disabled people, and the Prime Minister's introduction points to the need for significant change. And I think it's the first time that we've seen in a government document an absolute acknowledgement in writing about the inequality and the size of the problem. However, it soon becomes apparent that the wide gulf exists between the deep and systemic inequalities faced by disabled people and the actions proposed by the government's disability strategy. This is not a strategy rooted in addressing the inequalities experienced by disabled people, but a compilation, we believe, of departmental actions, some which are already and were already in progress. What hits you about the strategies is what it doesn't include. It doesn't address the shockingly low levels of benefits for millions of disabled people who are forced to live on. It doesn't strengthen equality legislation or make enforcement easier. It doesn't state that all new build homes will be accessible. It doesn't set aside an end date for train stations being accessible. It doesn't include the inadequacy of social care or reduced charging. It doesn't improve the education received by disabled learners, and it proposes no bold measures to tackle the disability employment gap. But of course, there are, as with all of these things, some kind of actions that the government have committed to. And some of those are things like BSO interpreters will be allowed into jury rooms. Voters in polling stations will be able to receive assistance from people they choose. Landlords will have to make reasonable adjustments to common parts of buildings. Support will be given to disabled candidates in local elections. And intensive personalised employment support will increase by a quarter. A free arts access card will be introduced, and the coastal path will be made more accessible. Now, while those actions on their own are welcome, and no doubt everybody would welcome those, they are far from the ambitious agenda for change and leaves millions of disabled people with kind of little hope that struggles of everyday life will be different. So I'll stop there, Adrian. Hopefully I haven't gone too far over my time.
No, you are within your time. Thank you, Cameron. That is a really sobering and frankly quite shocking array of statistics and pieces of information. I think I had a sense of how poor and challenging the situation can be for people with a disability in the UK, but that really lays bare some of the facts of the matter. And we know the pandemic has widened inequalities, but to hear it laid out so barely is very powerful. So thank you for that. And I understand you're able to stick around for a bit and participate in the Q&A at the end, and after we've heard from our other speakers. So thank you very much for that opening speech. Mark Upton, would you like to unmute yourself and kick off by introducing yourself and telling us a bit about Oxfordshire Association for the Blind and the work that you do?
Yeah, thank you, Adrian. Yeah, hello everybody. Firstly, thank you so much for inviting us on. It's a real honour to be here and obviously sharing what we do and our experiences. So thank you very much for that. So we are Oxfordshire Association for the Blind. We support anybody who has a visual impairment in the county of Oxfordshire. So that could be any degree of vision. We'll support them through various different services and support areas. So a lot of our work is actually involved in that first point of diagnosis. So having a point of contact at the eye hospital to ensure that when somebody receives that diagnosis of sight loss, that we are there to provide that support, information and guidance, and help those people to look to the future and to obviously realise what the future is ahead and how we can support them in that. We also provide a range of other services, including information and advice, which is a really important one, is actually just having that person at the end of the phone with experience, both lived experience and knowledge of visual impairment and the services available. And then we can actually be that point of contact for them and provide that on the ground support and local knowledge. We have a resource centre here in Oxford, which is kitted out with all sorts of daily living aids. I won't go into too much detail, but if you're ever able to, do come in. We've got a lot of different things that can help people. Basic things from lighting to talking watches and clocks, to some of the high-tech items, computers with specialist software, to some of the things that you're probably very familiar with that can be beneficial, your Amazon Echoes and your Google Homes, and things like that, which we do a lot of demonstrations and training for. So one of our big areas now is tech training, ensuring people can get online, and we know how important that is, and ensuring people can adapt and actually be able to access the internet, and that takes a lot of training, a lot of support, and that's something we provide. We do emotional support, counselling, we do clubs and groups, so that peer-to-peer support is really important. Again, it's not just about us telling people how to live their lives or what they need to do, but actually, you know, learning from each other is really important. Learning those tricks, those tips for daily life and independence, and actually being able to support each other in that. And we support anybody for any age. So we have met clients from 2 to 102, which, as you can imagine, does change the services slightly. So we have a specific person working with children and young people. So we do activities and events for children and young people. Some really exciting things. For instance, we do sound tennis, which is tennis for visually impaired people, with a ball which has ball bearings in. And a slightly different way of playing it, but it's adapted, and it means that young people can get outside, get active, and play a sport which they wouldn't be able to play anywhere else. And that's really important for young people to be able to, you know, have those adaptations. And we also work a lot across in terms of campaigning and ensuring that there is access to the built environment around us, you know, ensuring that, you know, what measures that councils are putting in place, particularly in the last year where there's been a lot of them, is ensuring that those are accessible for blind and partially sighted people, and that you can actually access them. So that's sort of us in a nutshell. I hope that sort of explained a little bit.
No, that's a really good overview. Thank you. And obviously COVID, like everyone else, you would have had a huge impact on your services. So give us a sense of how you've been responding to that and what's changed over the last 16, 18 months.
Yeah, so we obviously, just like everybody else last March, we were sat there thinking, well, what on earth is happening? What are we going to do about it? And we took our services, obviously stopped a lot of our face-to-face work, and we provided that telephone support. So our first reaction was to actually just call everybody that we worked with to ensure that they had support and supplies from their local community. So a lot of things were very visual to start with, things like notes through your door from the neighbour, notes from, you know, things posted on websites which people may not have been able to access. So we proactively contacted people to ensure that they had that access in that local community and connected them with some of those local provisions, and that was sort of our first reaction. We then, from there, offered regular phone calls for those who were quite isolated and lonely. So for those from the older communities, we were able to actually have that regular contact, and then also support for the parents and the families of young people who were having to homeschool, who often would have had a lot of support within the school, a lot of adaptations. The parents were having to work it out themselves, which meant we were sort of there to give support, encouragement, and advice where we could. And there was a lot, we had to pick up a lot, as you can imagine. A lot of the measures that are coming in, as Kamran was just explaining, they were all very visual. So staying 2 meters apart, following a lot of those queuing systems within the shops, and understanding that and being able to navigate that, you know, going online to do different things. These were all very visual things which people, you know, had to adapt to. So a lot of people are very anxious, and still are, because some of those measures still exist. You know, from simple things to a perspex screen in a shop can cause a lot of glare. It's going to be quite hard to see who's behind it, if anybody, for people with low vision. So these could be very hard things to adapt to. So we were having to obviously help people navigate that. The other thing as well is, just as Kamran pointed out, it wasn't until June or July last year where people who are blind or partially sighted were actually eligible for home deliveries. So you think from March to June and July, people were having to kind of work it out, their shopping. So that's something we obviously had to work on. And we're really pleased that our national charities like RNIB were able to push those organisations. But it was very late, you know, people, that's a long time without home delivery. So again, it's picking up that, and then obviously working with people with their anxieties, ensuring that they were kind of kept safe, secure, and obviously encouraging people through their journey of independence. And we did see that it had a huge knock-on effect for people's independent skills, things like mobility skills. If you're not using them very regularly, they can...
Sorry, carry on.
Suddenly you need to...
I lost you there slightly. I don't know if that was my connection, but thank you. That was a really good overview. And moving on, looking to the future, Mark, what are the kind of challenges and opportunities you see for people who are blind or have limited vision in the future?
Yeah, so we are obviously working with people in terms of that coming back into that new normal, and I think that's one thing we're having to work with people on, is discovering what that new normal is, and how people are fitting into that. How blind and partially sighted people can navigate this new world. And we're also, there are benefits as well, that we are a lot more connected now, I think, than we were before, both as an organisation and as individuals. We can connect through, obviously through what we're doing now, through Zoom and Teams and things. So we have a lot more connectivity. So we can see a lot more opportunities there to connect people together who are maybe in rural communities who would not have been able to have that same support network which they've had before. So that's certainly an area we've seen obviously a lot of change in. We're hoping that will give more opportunities for people. And it's also, we're seeing a lot more conversations about the digital divide, and I think that's really important, is we need to upskill and to help people and to encourage people to get those skills to go online, and that's a really important one for us. So we think that the pandemic has sped that up quite a bit, and will ensure organisations like ourselves and those with the funding to support it see the importance of getting disabled people and, in our instance, visually impaired people online and being able to access information and content. So we're hoping we'll see a kind of shift in that area, which will really, end with more inclusion, hopefully.
Great, thank you, Mark. That's a really interesting insight into your work and some of the challenges you've been facing over the last year or so. Can I ask Gita now to unmute yourself? And Gita, thank you for joining us this afternoon. And do you want to kick off by introducing yourself and Autism Family Support Oxfordshire?
Yep, thank you, Adrian. So I'm Gita Lobo. I'm Chief Executive of Autism Family Support Oxfordshire. And Adrian, you're going to have to give me a nudge probably, because I can talk about autism family support all day. I'll try not to do that. So please do butt in and tell me to shush it if you need to. But basically, we're known as the autism people in Oxfordshire, and that's because we've been around for a long time. So we've been around for over 40 years, supporting children and their families, autistic children and their families. What we do now is basically, it's in line with our ethos, which is nurture, enable and inspire. So everything we do, we like to think is very nurturing, from supporting children from the beginning of their diagnosis and their autism journey, enabling, so we're enabling parents and young people, and inspiring and involving obviously our families and our children in that inspiration to inspire our young people as well as parents also supporting each other. So what do? So we do a lot. We're quite holistic in our support. It's family support that we aim for. So one of the things that we do is advice surgeries, or advice and support for parents. And this is probably a lot of what my family support team do, giving one-to-one advice and information to families as and when they need it, or as close to as and when they need it. We know that just sometimes having a listening ear for somebody to listen and talk to, or knowing somebody's on the end of the phone, can be a real support for a family that might well be heading towards a crisis situation. We also provide post-diagnostic support for families. So after they're diagnosed, all families in Oxfordshire are told by the clinician, ring this number, and it's our office number normally, because we're commissioned by CAMHS to run a post-diagnostic course. And this is a 6-week course for families. It's brilliant. These families will get to meet a speech and language therapist, an OT, an occupational therapist, and they might not see these professionals again for years or ever again, but they'll be able to talk about and learn about sensory difficulties and communication difficulties and that kind of thing. So it's a great course that we can provide after your child has been diagnosed. We also provide one-to-one support for young people. So we provide one-to-one support for 14 to 25-year-olds. We're a tiny team, so it's limited to what we can do, but we know that it's a real need for young people to be able to talk about their autism, and then coping mechanisms and regulating emotions and all that kind of thing. So our community outreach worker will be able to do limited but targeted support to young people who are 14 to 25 years old. And then we do a load of fun stuff as well with young people and children. So we run 4 youth groups, and we run holiday activities in the summer and the Easter holiday activities. So we're just finishing our last week of summer activities, which has been fun, but hard work, because we're out there in the community again, and we haven't been for so long. And it's supporting lots of young people. So that's great. We also run peer support groups, which as Mark was saying, we know is really, really valuable for young people. We do other training, so lots of other training as and when needed. So if professionals need training on autism awareness, we'll do that. We support children with things like sex and relationships training and social skills. We don't do as much of that as we would like to because of resources, but that's a real need. And we basically have 3,500 children and young people known to us, and 6 full-time equivalent staff. So you can do the math and realise we do a lot. Every year when I do the annual report, I can't believe that we've done all this stuff, and how we've done it, I don't know. But yeah, we try to do as much as possible.
And And thinking about those thousands of people and families you're supporting, what's life been like for them through the pandemic, through coming in and out of lockdowns repeatedly over the last 18 months?
Yeah, so it's been really varied. So I have to say, and it's changed over the course of the pandemic. It's been different, and we kind of knew that would happen. So we were prepared for that kind of ups and downs or waves of when families might need our support. And most families have struggled at some point during the pandemic, but some have thrived. So some have done really well just by the change that has been at home and not going to school and things like that. But as I said, most families have struggled, and those struggles, if I just list a few of them for today, a major one really is being able to cope with the amount of change and the amount of unknown that the pandemic brought us and is still bringing us. And for autistic people, being able to predict what's going to happen in your day, in the next minute, tomorrow, is really, really important so that they can make sense of what's going on. Obviously, not lots of our young people don't understand sort of the social cues or planning ahead and diary planning and calendars and that kind of thing. It has to be quite obvious what's going to happen, and they need to be able to predict it. And nobody could predict what was been happening for the last nearly 2 years. So it was difficult for most of us, and really difficult for somebody who needs to be able to predict and know what's going to be happening so that they can plan. And not only for the child, but for the families and the parents. So parents are exhausted. Normally, without COVID, parents will need to plan ahead, always preempting the next step for their young person, so their young person knows what to expect. And of course, when you don't know how long they're going to be off school or when their club is going to reopen, it's a difficulty, and you're just constantly trying to just, keep crisis at bay, really.
Yeah, I can imagine. And looking to the future, in as much as we know what's in store around the corner, what do you see as the outlook for the families that you're working with, and the possibilities and for autism support more broadly?
So needs of what families need now, do you mean? Or
and thinking into the future, what the kind of opportunities and fears for the future for them?
I think the need for timely support. So I've mentioned that already, but it's really important. Families come to us in crisis a lot of the time. And it's really difficult because we're such a small team. We are trying to constantly, prioritise families almost, those that really need us, and squeezing their appointments in. So what our families are constantly telling us is they need more of everything we do, and more timely. So unfortunately, the way that systems are at the moment, they're not proactive, and we know this, including ourselves. We're nowhere near as proactive as we should be and want to be, to prevent young people going into crisis. And that's what we're seeing. We're seeing a lot more of that during the pandemic. Demand for our support has gone up by 35% at least. And unfortunately, we've seen a lot more young people with suicidal thoughts and being unsafe or having risky behaviours. So actually, families just want to know that there's somewhere they can go to and get timely support before they all spiral into crisis.
Thank you, and I think makes the case very powerfully for the work you do, and thank you for everything you've been doing. And if you're able to stick on, where I think there's quite a lively chat box going on, so I'm sure we will have some discussion in a short while.
Well, can I just say one more thing, Adrian?
Yes.
One more thing. Another thing that's really needed is actually those children who don't yet have a diagnosis. So I have to say this because it's a real life problem at the moment. So if you have a child who's awaiting a diagnostic assessment for autism, you've currently got a 3-year wait with the NHS, and that's just for the diagnostic assessment. And obviously COVID has impacted what clinicians can do in terms of social distancing and staff being deployed elsewhere. So this is a real thing that we're raising as an issue, that you need to get all these children on a waiting list, need those assessments.
Thank you, Gita. Now, finally, can I ask Nigel Taylor of My Life, My Choice trustee, if you could unmute yourself? And are you there, Nigel?
I've Just had a message from a colleague at My Life, My Choice saying Nigel's struggling to hear. He is here, and I think he's getting help from a neighbour, but he's unmuted at the moment and can't hear us, and we can't hear him. So I can see that somebody's helping him there.
Nigel, can you hear us?
There seems to be a sound problem, I think.
Yes.
I don't think he can hear us, and he is currently unmuted and we can't hear him. What's going on there? So that's a real shame if we can't get him on. Yeah, I can see him talking, but I can't hear him, and he's unmuted.
Do we want to take a questions?
Let's take some questions and see if Nigel can sort that out, and I'll let his colleague know as well. So the first question I thought we'd take was from Joanna at Unlimited Oxfordshire. Joanna, perhaps you can just talk a bit about your question, which was for Mark, I think.
It was. Can you hear me?
Yes, we can't see you, but we can hear you.
No, I'll unthingy myself. There you go. Hi, thank you. So yes, Unlimited Oxfordshire is a local disabled people's organisation for Oxford and Oxfordshire, and we are all run by volunteers who are disabled people. And Mark and I have actually been doing a bit of work together anyway around issues and barriers for disabled people. So the question really was about some of the issues that were caused as lockdown opened up. So for an example of that were pavements and roads being used for outdoor dining and drinking. And so it was a question around how local organisations can ensure the voice of disabled people is proactively included, and not local organisations always having to chase up on issues. So it's around voice and representation, really.
Yeah, hello, Joanna. Thank you. Good to see you. Yeah, it's such a big issue at the moment, obviously nationally as well, as certain things which have been obviously quite basic access needs have just been thrown out the window pretty quickly to enable cafes and bars and restaurants to have more outdoor seating. And we've seen some places who have done it well, and they've managed to do it well, and other places which have been absolutely horrific in terms of access, in terms of tables and chairs just spread out everywhere, people unable to navigate their way past. And I think a lot of disabled people face this issue. It's obviously not just visual impairment, wheelchair users and people with other access issues. So it's a big issue. And I think my feeling is it comes back to the local authorities who are, giving out these licenses. So each organisation will have to have a license to have an outdoor seating area. Now, it comes down to the local authority to ensure that disabled people are having a voice in this and being able to comment on that area and actually express whether it is accessible or not, and to ensure disabled people are being consulted. Now, some councils are doing that, some aren't. So really it comes down to having key people to talk to and to actually have walkarounds and check these situations out, because you're right, organisations do end up and other people do end up having to just keep banging that drum over and over and saying the same issues. And it often comes down to the individuals facing the barrier itself who have to put up a fight to actually get through or to get into a shop or anything like that, which it shouldn't be like that. The organisations, the businesses should be thinking proactively. And unfortunately, because these things have happened so quickly, disabled people haven't necessarily been consulted or thought about until it's too late and that barrier has been in place. But I do think the councils need to be proactively engaging disabled people and ensuring they are having a voice in that situation. I hope that helps. Makes sense.
Thank you, Mark. Joanna, did you want to add anything to that?
Well, to support what Mark sent with the evidence that we've been involved in, colleagues trundling along mobility scooters to protest about the issues of access, and that feeling of, well, it's great that lockdown opened up. Of course it was fantastic, and of course it was social opportunities for disabled people and non-disabled people alike, but just yet once again that sort of catch-up process. You know, we're here, we have access needs, now we've got to fight for them all over again. So it was, you know, how can we break that pattern, really? Oxfordshire, I think I'm right in saying this, do not have a single access officer left. And no, so it comes under equality, and of course they're, you know, it's a very overstretched role, and you know, it's a huge issue. Those roles got cut about 5-6 years ago, I think, and there's been no replacement at a statutory level at all.
No, unfortunately, like a lot of these things, and I don't want to go down this road, but it gets pushed back to the charity sector. Things which are, you know, within the Equality Act and within the council's remit, get pushed back to the charity sector, which is a real shame, because we don't actually, like yourselves, don't have the capacity to cover every area. So, and people get left behind and get excluded.
Thank you. I think, Nigel, I think we're probably not able to hear you still.
Yeah, we do have a suggestion that I try and call him to get the sound coming through. So I could try and do that. I do have Nigel's number, so I could call him. But perhaps in the meantime, if I try and sort that out, you could take a question from Tanya McAuliffe for Kamran, who wondered whether there's any data on whether those with a disability were prioritised by locally organised groups for befriending and food parcel deliveries and that kind of thing.
So I think what happened was the government decided to, so with the kind of 2.2 million people asked to shield, I believe, you know, that data was held centrally and then passed out to services. But I think where my belief is government got it wrong is actually what they should have done is ask those decisions to be made locally, because actually the knowledge exists locally within your, you know, your GP surgeries, your CCGs and other services that exist locally, and those local decisions should have been made rather than this central list from government that then missed lots of people. And so yes, people who were on the shielded list got a service of food parcels, food packages, but actually lots of disabled people who were not on the shielding list but just didn't have access to food, for example, whether that be online shopping or, as has been mentioned by Mark, about the ability to, you know, go into your usual supermarket because of the new rules that were brought in. So this whole keeping 2 meters apart. If you're blind or visually impaired, that's actually almost impossible to do, and so on. So I think that's where it went wrong. I don't know if there is a particular data on the numbers that we're talking about, but I would imagine it's considerable, and some of what people are saying just today points to that, I think.
Thank you. I've got a quick follow-up question for you, Kamran, on the benefits question. When you talked about legacy benefits, was that disability living allowance and capacity benefit, those benefits you were
Yes, that's right. That's right. So many people still haven't moved over to PIP or universal credit. And so if you're on those legacy benefits, the £20 uplift that was given to everybody, £20 a week. So it's not an inconsiderable amount. It's, you know, if you're, that can be the difference between having a meal or not every day of the week. So yes, that's the benefits it talked about. And when we've been challenging government, not just us, but lots of other groups, but we haven't been able to shift it. And in the last budget from Rishi Sunak, where he extended that £20 a week, it was not extended still.
Thank you. I think in the absence of a connection with Nigel working, I'm probably going to say, I think Bryan from My Life, My Choice might be here and able to say a few words about.
Adrian, I do have Nigel on the phone.
Okay. Would you want to try talking to him directly and see if that works?
So I'm going to try holding the phone up to the computer so that you can hear the sound, and I'm going to spotlight him so you can see him. Let's see if this works. I've never done this before. Hold on a sec. Right. Okay, Nigel, can you speak so that we can see if we can hear you? Nigel, are you there, Nigel? Yeah. Okay, can you hear him, Adrian?
It's quite quiet.
Yeah, we might struggle a bit with this. I think maybe we just need to say thank you very much to Nigel for trying his very best to get on, but I don't think we can hear you well enough for it to work, Nigel. So I think we're going to take another question.
Unless is Bryan or someone else from My Life, My Choice able to say a few words on?
Bryan is on the line, so perhaps Bryan could just give us a little bit of background.
Bryan, do you want to unmute yourself and
explain to Nigel?
Turn your camera on as well. Okay, do you want to take the spotlight off Nigel? Bryan, over to you. Do you want to just say a little bit about My Life, My Choice and how you work and the importance of lived experience of being at the heart of what you do?
Yeah, fine. Good afternoon, everybody. Just check. Can you hear me, Adrian?
Yeah, you're loud and clear. I'm pleased to say.
Okay. All right. Cool. Yeah. So My Life, My Choice is a charity that is run by and for people with learning disabilities. So all of our trustees have a learning disability, and that makes us fairly unique in the way that we're user-led, and that's something we're very, very proud about. In terms of what we're about and what we do, we have a lot of different activities and projects, but at the core of what we're about is supporting people with a learning disability to have a voice, to have a say, and to improve their quality of lives themselves. Projects, we have a Gig Buddies project, so people are matched up with a volunteer so they can go out and do the things they love to do, go to the cinema, go to a football match, etc. Travel Buddy project, so an individual who's confident of traveling with a learning disability will match up with a peer and then train them to travel on public transport on a predetermined journey. We also have a fee earning arm called Power Up, which we do training, consultancies, research, something called Easy Read, which is turning information into accessible format for people with a learning disability. So that's a general sense of what we do. There is other stuff. I think from listening to the other speakers, I'll guess what the requirements of the speakers were, but stop me if I'm getting it wrong, Adrian. But I think you know, what did we do when the pandemic hit? Well, I think panic, like most people. But we made a very quick decision that we would, whether it even meant the demise of the charity, we were going to put all our resources into supporting our members. And if the funding didn't come, if there were big problems, then My Life, My Choice might end, but we'd do the best we could for a 6 to 12 month period. As it happened, funders were very flexible, very supportive. There was government support as well, as we all know, and things turned out pretty well for us. So what we were able to do was similar to what Mark said, the Oxfordshire Association for the Blind did. We rang up all of their 650 odd members to check, first of all, how they were doing, if they had the right support. That then turned into a long-term phone buddy project. So about 150 people were regularly contacted and by a volunteer to make sure they were okay and just to give them some kind of social contact. During the different periods when there wasn't a lockdown, we were able to run some walking clubs, so just to get people outside and meeting people, and to have some physical exercise. One of the big things we did, and Oxford Community Foundation helped, considering the funding for this, was to turn the government advice and guidelines around COVID into accessible format, and then once every 2 weeks we'd send out a physical mail out to our 650 odd members in Easy Read, so that they could hopefully understand what the government was trying to say, and we all know that was difficult for all of us at times. So that was an important piece of work that is just starting to wind down now, but we may have to kick on with it again, perhaps in the winter. There was a nice piece of work we did where we were able to, during the last lockdown, to send out to all our members, we called them wellness packs or goodie bags. So we sent out hats and face masks and chocolates and all sorts of things, and activity books to try and raise spirits during the lockdown. And then a piece of work that's now going to carry on for the next couple of years is a digital inclusion project, which unfortunately Nigel has sort of showcased for us, because he was there. We did see him. He did have a laptop that we provided for him, but unfortunately didn't quite get it 100% correct. But we've managed to give out, I think we're up to 50 odd devices now, free of charge to members. That's been backed up with a lot of training and support. And through Oxford Community Foundation's step change, we've now been able to extend that for the next couple of years. So that's going to be a major piece of work for us now. And I'm sure that's quite similar with a lot of the different organisations. Looking at the challenges. Oh, sorry, Adrian.
Yeah, give us a quick thought on challenges, and then we're going to have to bring it to a close. That'd be great. Challenges,
yeah, I think accessible information, big thing. Mark mentioned it from a different perspective. For our members, it's been a challenge for years and years, but really highlighted with COVID. It's a real gap in the public sector, getting information out to people in an accessible format. And the last thing, Adrian, I think it's important just to highlight that people with learning disability are not a homogenous group. They're not all at home anxious about what is happening with COVID, and they're all scared about going out and doing anything. So it's very mixed bag. We have some people like that. We have a lot of people that now want to get back out and they want face-to-face activities up and running again.
Thank you, Brian, and thank you for stepping in at the last minute. And apologies again to Nigel that we couldn't get the technology to work for you. But thank you very much, everyone, for turning out. What's been a really interesting session as ever. And I remain in awe of the amazing work that so many great local organisations are doing, and so many great national organisations are doing. So thank you, Kamran, for making the time today. Thank you, Mark, for giving us insights into the work of our AB, and thank you, Gita, for your passionate, as ever, contribution and the clear, huge amount of energy and drive you bring to what you do. And thank you, Brian, for stepping in for Nigel. And it's very, very appropriate, Brian, that you mentioned step change, because our next webinar on the 29th of September is going to be focusing on step change and the invaluable support they've provided to numerous organisations across the organisation over recent years, and getting a bit more insight into what they do and how they work. And I'm sure that will be a very well attended session. So I look forward to seeing you all then. In the meantime, please enjoy the summer, the Paralympics, and everything else that you can. Thank you very much.